The president does fall into an at-risk category, and Dr. David Banach is an infectious disease physician at UConn Health. He is joining us live now to talk about the president's diagnosis and what we can expect. Thank you, doctor, for being here.
Thank you for having me.
We know that the president has mild symptoms now. Do the symptoms typically progress over the first few days, or how long would it take to determine if he's actually going to get quite sick?
So I think that's a great question. The one thing that we know for sure is that there's a lot of variability. Some individuals develop very mild symptoms for the duration of their illness. Some individuals develop mild symptoms at the beginning, but do progress to more severe illness. So again, without knowing the details of the president's symptoms, things we'd want to look for, any respiratory symptoms, particularly shortness of breath, coughing, those kinds of symptoms are the ones that we see as progressing throughout the disease course into more severe illness. So I think careful monitoring, being very vigilant in the upcoming days is going to be really important.
And we know the president was inside with a lot of people at a fundraiser in New Jersey yesterday, just hours before testing positives. So now what needs to happen? Are those people who are around him, are they at risk? Do they also need to quarantine now?
So the contact tracing is going to be really important. It's going to be quite intensive. Given the number of contacts that the president has with others. We think about that window period, the 48 hours prior to the onset of symptoms is really what we're honing in on. And those individuals who would be at risk would be the ones in what we call prolonged close contact. So within 6 feet of the president for an extended period of time, typically more than about 15 minutes, are the ones that we'd want to be attentive to for contact tracing. The public health authorities would reach out to them and advise them to quarantine, as well as potentially offer testing to them to try to see their status.
Doctor, just quickly, President Biden was obviously with Trump at the debate, but they were kept apart. How would you assess his risk? Low, high?
So I think the distance between them is really important. I think that was well planned, making sure that they're a nice distance apart, just in case either individual were infected. I think if the distance is beyond the 6 feet, the risk is much lower. I don't think we can say for certain it's zero, but definitely much lower than those individuals in close contact.
Thank you, Dr. David Banach from UConn, being with us today. Thank you for shedding some light.
Thank you for having me on.